The governor's 2015-16 budget proposes significant changes to the health benefits that the state provides to retired state employees. The governor's proposal would affect about 3/4 of the state workforce and would affect current and future state employees who work for the executive, legislative, and judicial branches of state government. Throughout this video, as well as throughout our report, we refer to state employees to mean those employees who are affected by the governor's proposal. Generally, this means all state employees except those who work for the University of California. The state generally provides health benefits to retired state employees who retire with at least 10 years of state service. Unlike pension benefits, the state doesn't set money aside each year to pre-fund these benefits. Instead, the state pays for these costs as premium costs are incurred after the employee retires. In 2015-16, the governor's budget assumes that the state will spend about $2 billion to pay the state's contribution towards retiree health premiums. Over the past 2 decades, these costs have grown significantly, mostly because of general cost increases in healthcare, but also because of a rising number of state retirees. Retiree health benefits earned by state employees in a particular year create a future obligation for the state. A fundamental principle of public finance is that costs should be paid in the year in which those costs are incurred. In the case of retiree health care, this means that the state should set money aside in the year that an employee earns this benefit to then pay for the cost of that benefit when the employee actually receives the benefit in retirement. Because the state has not been putting money aside to pre-fund retiree health benefits, the state has a large unfunded liability resulting from these benefits that have been earned to date by current active and retired state employees. According to the most recent actuarial valuation released by the State Controller's Office, this unfunded liability is about $72 billion. This constitutes the last major state liability that does not have a funding plan. We think that developing a funding plan to address this unfunded liability should be a high priority for the legislature. The longer that it takes for the state to adopt a plan to address this liability, the larger the problem will become and the more expensive the solution.